I wanted to take a minute to talk about this really stupid graphic that's going around. It says, when you think owning a gun is more of a right than being cared for when you are sick, you really need to re-examine your priorities. Well, these people really need to re-examine what the hell they're talking about, because it's clear they don't even know what a right is. And this is something that has pervaded the healthcare discussion since day one. You know, they talk about this right to healthcare and that it's your right to be cared for when you're sick, and they really don't understand the nature of what rights are. When we talk about rights, rights happen in a negative sense, meaning that they negate the kind of things that others can do to you. And if you're confused by what that means, just look at this graphic, because the fallacy is encapsulated right in the phrasing of this graphic. Owning a gun is in the active voice. Being cared for when you're sick is in the passive voice. And here's a hint. When you're in a political discussion and someone is using the passive voice, it usually means that something not very good is going on. Owning a gun is something you just do yourself. You've got yourself and you've got the gun. Maybe it's in your hand, maybe it's in a holster or, locked in a drawer somewhere. But you have the gun and no one else is involved. And in order to violate that right to own a gun, someone would have to come and do something to you. They'd have to steal the gun or arrest you or whatever. And that's what we mean by rights being negative. This right to be cared for when you're sick, well, here's the thing you always have to ask when someone uses the passive voice. Being cared for by whom? So right here in the phrasing of this graphic is the idea that you're entitled to someone else's labor and resources. You're entitled to have a doctor or a hospital or whatever care for you, and you're entitled to make someone else pay for it, apparently, because if that's your right, then apparently that's all the things that you can demand. Rights do not work that way, people! Get over it! That's not what a right is. You do not have the right to someone else's time or labor or money. If you do, you are saying that that other person is your slave. That is exactly what this graphic is saying. And if you really don't believe me in this, then just read the First Amendment and think about what it says. And I'm thinking specifically about the part of freedom of the press. We have the right to a free press. What does that mean? That means that if you want to run a newspaper, then government cannot stop you from doing this. If you can legally obtain a printing press, purchase a printing press and start up your own newspaper, government can't do anything to stop you. That does not mean that you have the right to someone else's printing press. That does not mean that someone else somewhere owes you a printing press and the paper and the ink and everything else you need to run your newspaper. That's not what that means. So if we do have a right to health care, then we have that right in a negative sense. And I absolutely believe that we do have a right to health care in the proper sense of the word right, which means the government can absolutely not interfere in your right to obtain health care however you legally can. Meaning going out and buying it or getting some charity to take care of it for you, going to a free clinic or a charity hospital or something like that. Every time government interferes, every time government says, we think your insurance plan needs to cover this and that, every time the government says, we think doctors should spend several hours a day filling out paperwork, every time government says, well, we're not going to let you have your medicine unless it's been FDA approved, every time government says, if your doctor says the medicine you need is marijuana, we're going to arrest you and put you in jail. Those are things that interfere with the actual right to health care that you have. And that is what is so stupid about this, and that's why they have to disguise it in the passive voice. They're trying to make out like it's a right because who's against rights? You're not against rights, are you? How can you be against someone's rights? What's the matter with you? But that's not what this is about. If this were really about our right to health care, they would be working to get government out of it. Because when government was out of health care, as I have shown many, many times before, we took care of each other. Health care was cheap. Insurance was cheap. There were other things such as mutual aid societies that competed with insurance. And there were free clinics and charity hospitals all over the place to take care of the few people who couldn't afford that. And then, of course, people came in and said, oh, we have the right to healthcare, let's get government involved, and that ended up in the mess we are today. And if you look over in countries that have universal healthcare, go through my podcast at bogosity.tv. Go through the archives. I have covered case after case after case after case after case of countries with universal healthcare engaging in rationing. There is a place in Canada where whether or not you can see a doctor that month depends on whether or not you win a lottery. In Sweden, there is someone who decides whether or not you deserve an ambulance at the time, and there are people dying of heart attacks and other problems because some bureaucrat on the other end of the phone, even if it is a bureaucrat with a nursing degree, just decided without actually being at the scene, without actually examining the person or anything like that, just decided that they didn't get an ambulance. Hey, say what you like against the current U.S. healthcare system, and there's a lot you can say against it, but at least if you call an ambulance, you get one. And for crying out loud, in the wonderful UK with their NHS, they're actually starving elderly people to death to free up bed space. And there are waiting lists that are so long that people who have treatable illnesses, by the time they get off the waiting list months later, their illness has progressed to the point where it's untreatable. That's rationing, people! That's rationing. It's just like in World War II. Okay, you have to have this many points if you want to eat meat this week. Well, they may as well do that. They may as well say, okay, here's a number of points that you have, and that determines how much health care you're entitled to. It's exactly the same, it's just hidden and more nefarious. And this permeates the healthcare debate. It always has since day one, and so few people are pointing out this fallacy. And yet, people understand this. The person who made this graphic understands this. If he didn't, he never would have used the passive voice when he created it. Why did he use the passive voice? That's a deliberate thing, using the passive voice. Your right to be cared for by someone else. He just leaves out the by someone else part. But that's the thing. You're not entitled to anyone else's resources. No one else owes you anything, and you don't owe anyone else anything. Being in a society does not mean that we are somehow obligated to be each other's slave. It means that we come together in peaceful, voluntary association, not by the point of the gun wielded by some bureaucrat who's trying to impose his own way of living your life on you. We can take care of each other. We are good and generous people. We've taken care of each other in the past, and we'll take care of each other in the future as long as you get government out of our way. But government has been meddling in healthcare for 45 years, fixing it and fixing it and fixing it. Oh, we got to fix it with limiting the number of physicians' licenses given. Oh, we've got to fix it with Medicare and Medicaid. Oh, we've got to fix it with the HMO Act. We've got to fix it with this. We've got to fix it with that. And after all this fixing, it's more broken than ever, and yet people are still blaming the free market and not thinking, but what about for the last 45 years? Wasn't government fixing it then? For those of you who missed it, I was recently on the Ed and Ethan podcast, and I'll see if I can get a link down in the video info box. And I mentioned something to them that Lord Hawkeye had said in one of our podcasts. And they're a group of Canadians, so I wanted their opinion on this. And I've asked other Canadians this too. They all say the same thing. In every election, every time it comes around, every politician, every candidate, everyone who's trying to get your vote is promising to fix healthcare. We'll fix healthcare. Elect me and we'll fix healthcare. Oh, vote for me. I know how to fix healthcare. Fix healthcare. Fix healthcare. Fix healthcare. Well, wait a minute, I thought the Canadian system was this wonderful thing where everyone was taken care of. Isn't that what's being held up as the model for us to follow? So it's like Canada is saying to the U.S., yes, look at our system, it's wonderful, and then they're saying to their own people, our system is broken, but vote for us again and we'll fix it. Come on, that's what it always is, and that's what it's always going to be. We promised to fix healthcare. We promised to fix the ambulance service in Sweden. We promised to fix the Liverpool Care thing over in the UK. We promised to fix it. Well, the promises keep coming, the fixes keep coming, and it just keeps getting more and more broken. When are we going to learn? When are we going to wake up and say, wait a minute? Yeah, I mean, if you had a leaky pipe, and you had a plumber come over and say, I'll fix your leaky pipe, and he fixes it and he leaves, and now it's dripping. And so you call the plumber, okay, you got to fix this pipe. So, oh, okay, I'll come in and fix it. And now it's trickling out. And then this keeps going over and over and over and over again, and pretty soon your kitchen's flooded. Well, who are you gonna blame for your kitchen being flooded? Are you gonna blame the original leak or whatever caused it? No, you should blame that idiot plumber that keeps coming back, and you should stop having him do that. You should say, I need to look for another solution than going back to this same plumber that failed time and time again. So when we talk about fixing healthcare, the way to fix healthcare would be to stop going back to the people who broke it. And that's government, people. That's government. If we really do have a right to healthcare, and if it really is so important that everyone have easy access to healthcare, then that's what we have to do. Go back and look at the video that I recently uploaded, How to Fix Healthcare Without Spending a Dime. Those are real fixes. And throughout that video, I asked the same question over and over and over again. Can you think of one good rational reason for not trying the stuff that I mentioned in that video? And no one can do it. No one can do it when I uploaded it a couple of years ago. And in all that time, no one has been able to give me a single reason not to do it. And yet they continually go back to, but we need government to do it. But we need government to do it. Sorry, been there, done that. What's it gonna take, people? What's that definition of insanity again? Doing the same thing and expecting different results? When you go back to a politician or a bureaucrat and ask him to fix healthcare yet again, why do you think it's going to work any better than the times that it's failed and failed and failed again? What's it gonna take? Really, I want to know. Answer in the comments, what's it going to take?